Hi, and welcome to everyone who's joined our Thoughtful Discussions by Nature and Thought for a Turmeric Masterclass. Hi, Neha. Thanks for joining in. I'm still waiting for it to be a sharp 6:30 so we can start. But just since we have a few minutes before, it would be great if y'all can use the comment sections to keep the conversation interactive. We may not be able to answer the question right then and there, but we promise that at the end of the session, we will try to get to as many questions as we can. If there is any feedback, any um, comments about the presentations, then you can even leave that for us in the comment section or email that to us separately. So thank you so much for joining again, and I'm just waiting for it to be sharp 6:30 to kick things off. Shifali, we have 1 minute to go, and then I'll kick things off.
Yes, absolutely.
Under a minute. If whoever has joined, it would be lovely to just get a hi from you. You can post that in a comment or a chat. That way we know you're here. And would be great to see a good show of hands to see who all are here. All right, Shafali, it's 6:30, so time to get things started. So
Yes, let's
welcome
start.
everyone. Yeah, welcome everyone to Thoughtful Discussions by Nature and Thought. Today we are looking at the Turmeric Masterclass. Now, one of the things, or maybe one of the many reasons that we have developed Nature and Thought as a brand, amongst the one that is the most pertinent to our discussion today is to spread the information about the right dose and the right format so that when you are looking at natural products, you understand their efficacy, you understand the format and the dose that is required to make them effective. So I am Rajat. I'm the chief evangelist at Nature and Thought. You can read a little bit about me, but I think the most important thing is a short story which helps make our discussion today more meaningful is in around 2005 2006 my father was diagnosed with a progressive neurological palsy type disease, and of course there was absolutely no allopathic type of treatment available for him, no surgery that could save his life, but everybody pointed us towards natural products. And at that time things like turmeric were not very prevalent or available in India as a supplement. So, and I was studying in the US and I had absolutely no idea. And I would go into your pharmacies and I would pick the bottle that had the highest milligrams and it had the most number of capsules without understanding anything. I don't think me selecting the right product would have saved my father's life because he was definitely on the more curative route and it was a little too late for him. But I do hope that us talking about this today and this topic will help all of you all develop a fair amount of knowledge and understanding of what it is that goes into turmeric, what are the different formulations, and what is the right dose. which brings us to just the cover of why we're talking about this today. So here are just a few of the natural products, and we're working towards developing an index like this. But when you look at turmeric, the active is curcuminoids, and the right dose is 1 to 3 grams of turmeric powder. Now, I don't want to take a lot away from our presenter today. So, without further ado, I'd like to introduce you to Dr. Shafali. So, Dr. Shafali is a physician with over 30 years of experience, and she practices medicine, and her core expertise is in Ayurveda. She actually contributes to design and conceptualization of various value-added nutraceutical products, one among them being turmeric, which is today the world's top leading edge, cutting edge turmeric. And for me, she really is the bridge between traditional science and modern science. So I love the fact that she brings that knowledge and expertise, and I'm so happy that she's going to be able to share this information with all of you today. So with that, Shafali, over to you.
Well, thank you so much, Rajat, for this introduction. And yes, I'm sure that we are going to talk a lot about turmeric today in today's masterclass. So, good evening, everyone. I once again welcome you to this masterclass, and let's understand more about turmeric, curcumin, and the supplements, the need of it, and why do we need, what benefits we are going to get, and so on and so forth. So, turmeric, as we all know in India, turmeric does not actually require a very specific introduction. Ever since, probably the first day of our life, for entire life, we do consume turmeric every day in almost every meal. Now, because the Western diets have seeped in, that's why that is the only time when probably we don't use turmeric in our diet. So, turmeric comes from the root or the rhizome of the Indian plant, that is Curcuma longa, the Latin scientific name. It is from the ginger family. It is native to India, and it dates the use of turmeric not only in the cuisine but in medicines, dates back to more than 4,000 years ago. It is very well mentioned in Ayurveda, and even before this, in the scriptures, before Ayurvedic scriptures came in place, turmeric is very well mentioned. So the question, if I ask you which country is the producer of world's best turmeric, I think you all should be knowing the answer. Well, of course, it is India, and more than 80% of it is also used within our country. And turmeric supplements are also, the best turmeric which the supplement manufacturers get is also from India. So turmeric, also commonly known as haldi powder, it's available in various forms, especially considering the supplements and the fortified foods which are available in plenty in today's market, in today's medical shops. So if we start with haldi powder, it's a turmeric root which is dried and which is ground down to a powder, which is found in our kitchen and which we use on daily basis. So it has 3 to 6% of curcuminoids per total weight of the powder. Now we will definitely come to what is curcuminoids. So I'm sure that you all have heard the word. Next is like turmeric extract. So from that root powder, the actives are sort of extracted so that in smaller amounts we get more quantity of phytoactives. So it has higher concentration of curcuminoids as compared to the powders. And of course, the heavy metals, contaminants, bacterial count, everything is controlled in a standardized turmeric extract if it is standardized. Now, going ahead, further research has given rise to a standard turmeric extract, which has 95% of curcuminoids. So now here, when we say that only 3 to 6% of curcuminoids are present in our standard turmeric root, they are brought to as high as 95% of curcuminoids. And then they are used mainly for supplements or in medicinal products in Ayurveda and so on. The fourth category which has emerged comparatively recently as compared to use of haldi right from 4 to 5,000 years back in India and in Ayurveda is bioavailable turmeric, and that is what we are going to talk more about today. It is, to say the least, a modified turmeric curcumin extract which is modified to make the absorption and bioavailability of the actives, that is curcuminoids, better. So that is about turmeric. right from haldi powder till bioavailable turmeric, which is available today. Now, if we consider the naturalness and versus bioavailability, of course, regular turmeric is natural. It has a lot of phytoactives, which we will see in our next slide. But if you look at the bioavailability, it is on the least. The standard turmeric powder which we use in our kitchen, the actives in that are not bioavailable. If we go to turmeric extract, while the naturalness is maintained, the bioavailability is not improved. So if you are using, or if you want to use turmeric extract for the health benefits, then yes, it will still remain on the lower side because the bioavailability of regular turmeric is not taken care of. The third category, if we look at, it is bioavailable turmeric, where the nomenclature goes, turmeric and the actives present in turmeric are made bioavailable, but in the process what happens is a lot of naturalness is lost. And I would like to highlight here that we have both golden hug with term extra 60N, which is a highly bioavailable and completely natural ingredient developed out of 95% turmeric extract. So the importance of being natural, or retaining the naturalness, the natural healing power of this herbal ingredient, and making it bioavailable in a natural manner cannot be more highlighted probably. And we'll talk more about it. So what are curcuminoids? Many of you must have heard that curcuminoids are actually the three active ingredients which are present in turmeric rhizome, which give the impart the yellowness to the turmeric rhizome. So these are the phytoactives, as in they are pharmacologically the most active phytochemicals present in the rhizome. They are known as curcuminoids collectively, but the major one is curcumin, and that is the reason why the word curcumin has become very common. So even in scientific papers, many times when curcumin is written, it is actually meant that it is curcumin plus the other two minor curcuminoids, that is dimethoxycurcumin or DMC, and bis-dimethoxycurcumin, that is BDMC. So as you can see here, curcumin is present in around 60 to 70% in a standard in the ratio. So around 70-75% is curcumin, 20 to 27% is DMC or dimethoxycurcumin, and remaining 10 to 15% is bis-dimethoxycurcumin. Now, whenever the pharmacological actions of turmeric or curcumin are being talked about, it is though majorly contributed by curcumin, it is contributed by all the three curcuminoids. Apart from these actives, other phytoactives or phytochemicals present are essential oil, which contains terpenes, monoterpenes, and sesquiterpenes. So these are all the major actives present in the turmeric rhizome. Curcumin, as we say, saw, it's a major active in turmeric powder. It is the primary yellow biocomponent of turmeric. Now, we all must have heard several health benefits of curcumin. So even I'm going to use the word curcumin for the collective actives of curcuminoids. So curcumin has a lot of pharmacological actions which are proven through many in vitro, in vivo research studies, and also through many clinical trials. It has anti-inflammatory effect, it has antioxidant, it is antimicrobial, it has immunomodulatory properties, it acts as a chemopreventive, and so on and so forth. Curcumin, it is tolerated well at high doses, even when it is concentrated in form of 95% or as extracted as per the standard processes. We all know that we all tolerate turmeric very well. So curcumin and curcuminoids go in the same way as far as tolerance is concerned. It has pertaining to so many pharmacological actions. It has potential to help with so many diseases. So before we go further with curcuminoids and its pleiotropic mode of action, I have a question for you all. What is standardization? What you all understand when we say standardization? So probably you all can, type out your response in the comments, and we'll wait for a few seconds.
Yeah, I just want to highlight that there are no prizes for this because the answer is also on the screen a bit. But also, when you think of turmeric, what is, and when you hear standardized turmeric, what do you take away from it? So you can leave your comments there, and if anybody has a specific answer, I would love to hear that. Hi, Shweta. So we have one answer which says standardization means getting the same product every time, right? So, Shafali, would that be a correct answer?
Well, yes, but in itself, like getting the same product every time. So probably if I'm not from the science side, even getting the same product in the same package, in the same size of capsule would probably mean for me as a layperson that, well, somewhere the term standardization maybe I can, apply. But let me take you all through what is the standardization process. So as it is written here, in a simple definition, it means that the manufacturer ensures that every batch of the product, so every time the production happens, it is produced by using the consistent and validated process with the same ingredients. Same ingredients again we mean that it is a qualitative and quantitative composition of the active ingredients which goes into each dosage format, like whether it is a capsule or a tablet or per 5 ml. We are used to using this kind of language for pharmaceutical drugs. If you look at any say a label of paracetamol syrup, then it will be written like 125 milligram per 5 ml. But then that the way pharmaceutical drugs it is ensured, the same standardization is ideally should be even applied to herbal supplements. But the problem is that herbal ingredients and herbal supplements follow lot of make other issues which are not present with the pharmaceutical drugs, because they are chemicals, they are synthetically manufactured, and it is very easy, it's a single entity to measure. I'm not an analyst, but of course I know that much, that you can analyze that how much paracetamol is present in a tablet or in capsule or probably the 5 ml of the syrup. But when it comes to herbal ingredients, and it is more so with other herbal supplements as compared to, say, for example, curcuminoids, because curcuminoids are quite standardized. We know the quantity of each curcuminoid in terms of their own ratio within the rhizome. Uh, but otherwise, what happens is then there are other phytoactives which seep in into the product. Sometimes those phytoactives are recognizable, but their mode of action is not known. Sometimes you can see it in some batches, not in others. And likewise, also the contamination rate which comes with the herbal raw material is inherently very high because they come from soil. So whatever is in the soil is going to be somewhere absorbed in the roots, in every plant part. So these are some issues which make standardization of herbal supplement not only difficult but even more important, because if there is an ingredient which about the activity of which we are not aware of, then it's not good to take such product as a supplement. And that is the reason why standardization has more importance in turmeric in herbal supplements, which also applies obviously to the turmeric supplements. So here, when since today we are talking specifically about turmeric, so a standardized turmeric extract will be able to give you a very clear concentration of curcuminoids. That every capsule has how many curcuminoids, like whether it is like 500 milligram, 250 milligram, it should not use the ambiguous language. If I'm giving only a turmeric extract, then I'm also giving you all the other essential and non-essential components which are present in that root or that rhizome. So standardization will give you an exact quantity of the actives. And once you know the exact quantity of the actives, you'll be able to define the exact dose that is required to get the exact health benefits. And of course, that leads to getting maximum health benefits because we are very clear about what the intake is. So that is the importance of standardization and also for the turmeric supplements. Now, having said that, I'll just take you very briefly through the pharmacological actions which curcumin is shown to exert in so many of in vivo and in vitro and in vivo trials, and also the same efficacy is observed in clinical trials. If you look at curcumin clinical research database, it's huge, like it is like more than 10,000 papers. So I made it very crisp and clear and short and sweet for you all. So curcumin exhibits like all other plants, plants which we consume, especially on daily basis, they are all high in their antioxidant activity, and because of that also it exerts a lot of beneficial effects. So same for curcumin. Curcumin is antioxidant. Most importantly, it has I mean, almost proven, you can say, a chemopreventive activity, as in it works on various complex metabolic pathways which are present in the pathology of cancers. It also has a positive effect in metabolic health, as in it is useful for your diabetes, your metabolic syndrome. Uh, Curcumin is very well proven to exert its effect in musculoskeletal health, meaning that it keeps your muscles and joints and bones very healthy. So, this all effects it does through targeting multiple targets at the same time. Curcumin has a lot of research going on in neuroprotection and in Alzheimer's disease. We'll highlight a little bit more about it later. Curcumin is also well tried in cardiovascular health, and it really helps maintain a very healthy lipid profile. So these are some of the few pharmacological actions of curcumin. Uh, what has happened like in the medical literature or medical research is that inflammation has come out to be a very one of the strongest pathogenetic mechanisms in many chronic diseases, meaning that inflammation is part of lot of diseases, how they take place, how they progress, and the kind of damage they do to the disease. In that, inflammation is becoming central pathogenetic mechanism. So curcumin is a very potent anti-inflammatory. It inhibits the two major enzymes like COX-2. It also works on the LOX-2. So little technical, but these are two main enzymes, the COX and LOX of the inflammatory cascade. And when curcumin blocks both the pathways, then inflammation is arrested at with very good potency. Curcumin also has an effect on the nuclear factor kappa B, which regulates inflammation. I mean, which regulates a lot of processes within the pathogenesis of many diseases like inflammation, cellular growth and proliferation, which is the mainstay of the cancers, then transformation and tumorigenesis. So curcumin suppresses the activation of this NF kappa B, which is the main culprit behind inflammation, right from a simple joint disease to something which happens in serious diseases like cancers. So it also blocks the gene expression, and this suppression of NF kappa B then leads to suppression of the entire inflammatory cycle. Of course, we can, a lot of literature is available about this anti-inflammatory mechanisms, pathways in the literature, and it can be made available for those who are interested. So now coming to why turmeric supplements. So in India, I think every time I hear of, whenever I want to talk about turmeric, and believe me, it has become one of my favorite ingredients for my practice, because in spite of being a simple spice, the health benefits of turmeric cannot be like, there's, even if we keep on talking about it, there is always a lot more to talk about it. So why turmeric supplements? Everybody will ask me. I take turmeric every day in my meals. Why do I need turmeric? That is simple question, which everybody feels is very simple. Now, ingesting turmeric powder by itself is not going to lead to major health benefits, which are actually associated with its mechanism of action. And it is because of the poor bioavailability of the curcuminoids. So as Rajat had highlighted in the beginning of the session, the right dose is something which is very important, and especially for turmeric and curcuminoids. So major issues with the turmeric powder, there are physical issues and there are pharmacological inherent issues of the molecule. So if you look at the turmeric powder, whatever we use in kitchen, as we discussed, I think a few slides before, that it can be contaminated, it can be adulterated. We are not testing every day. We don't have that kind of time to test my turmeric before I put it in a curry or in a gravy. So the same powder cannot be expected to give you the multiple health benefits, like starting from reduction of cholesterol and maintenance of your intestinal health, and likewise. So these are the basic issues which differentiate the standard turmeric powder from the turmeric supplements standardization, as we talked about it. And then there are pharmacological issues which are inherent with the curcuminoids, as in curcuminoids are poorly absorbed. So they, when you ingest turmeric powder, the curcumin and the three curcuminoids, they don't get from your stomach to bloodstream very easily. Even if whatever amount is absorbed, then that undergoes a rapid metabolism, meaning that liver converts them into inactive metabolites. So whatever turmeric is absorbed and trying to reach blood, and then from blood to your various systems, like your hurting joint, or intestine which is facing indigestion, before it can reach there, it is inactivated by liver. And once it is inactivated, that is the purpose, to throw out of the body. So these are the three inherent issues which make standard turmeric powder almost unusable for major health benefits. So the right dose, as we have put again here. So active ingredient in traditional powders is always low, and in standard extracts it is generally high. But bioavailability, even in those standard extracts, even if I am making like from 5% of curcuminoid to 95% of curcuminoid, I'm not doing anything to make it more absorbable in the body or more utilizable by the body. So that is the area where the bioavailable turmeric comes in. Also, if you want to take traditional powder, supposing that even turmeric is absorbed, curcumin is absorbed from turmeric powder, even if we consider that hypothetical situation, consider the dose which is required to get those curcuminoids in a therapeutic dose. So that will be like 3 to 5 teaspoons in a day, in multiple divided doses. Now, anybody who has even tasted turmeric powder can be very sure that you cannot take that kind of turmeric powder 2-3 times in a day for like days, weeks, and months. No, I am sure it doesn't work that way. Coming to capsules, even if you take standard extracts in the capsules, taking 2 to 3 capsules every day, along with all the traditional medicines that we all are on some of the other medicinal drug today. So along with that to take, it always creates a very high issue of compliance. So if you have to choose between like your rosuvastatin and turmeric, you are not going to stop rosuvastatin, because your doctor is going to really pull his gun and tell you not to stop it. So the compliance for supplements is also affected when you just take a standardized extract. Now, bioavailability of turmeric, there have been several efforts to increase the bioavailability, because once the scientists know the problem, they are going to work towards the solution to the problem. So likewise, like here, I'm not a formulator, but I put some methods which are used in, by the supplement makers. They do lipid additions, they use turmeric oil, or, they add piperine. That's something interesting. I'm going to talk a little more about it. Then some of the other methods are like adsorption and dispersion in matrices. So they do it by using, they even use synthetic excipients and solvents in this process. Then there is like particle size reduction, which can lead to a nano formulation. Again, about which I'll tell you a little bit more in detail, that what a nano formulation can do and what the maker of nano formulation should be doing, what kind of testing they should be doing before they put it in market. So these are few of the methodologies which are used to make the turmeric bioavailable. However, the formulations which are available today and which are claiming to be bioavailable, they do not have the supportive data. So if I am saying that my turmeric is bioavailable, the standard extract is, say, it is present, or rather it is not absorbed in the body, it is absorbed only like in a certain quantity, in nanogram or picogram per ml in the blood, then I should be having a comparative data that how much my supplement is absorbed as compared to the standard turmeric extract. So that kind of data, that kind of clinical study and clinical evidence is not available with most of the formulation manufacturers. So the claims of enhanced bioavailability and enhanced clinical effect cannot be made just because you have applied some method or some process to your product. You also have to clinically validate it, and also the results have to be proven in the real time data. The subjects or the patients or the people taking it should actually report that benefit. Only then it is going to be of a value, a real value. So coming back to piperine. So piperine or piperine, as you call it, it's a active ingredient of the black pepper, which we eat every day. Of course, it is available in the standard black pepper powder in small quantities, so that whatever black pepper we are using in our spices in our food is not going to cause any adverse effect. Now, same piperine, if we are extracting out and making a sole single ingredient piperine, so it is a phytochemical. So we are isolating one phytochemical out of the entire black pepper. And also there is one other herb which is available in India, long pepper, that also has piperine. So it can have its own adverse effects. In Ayurveda also, I would like to quote that piperine, or it is known to be vidahi. You cannot keep on having black pepper even in your diet every day. And I'm sure that in all our recipes, black pepper is not part of our every recipe, like the way turmeric is. So piperine has its own side effect. Now, the studies have shown that piperine also increases the absorption and not I would say not absorption, but the bioavailability, because it's a metabolism inhibitor. So it increases the bioavailability of many pharmaceutical drugs. So like some of the statins, and there are some other drugs which show much more bioavailability when they are combined with piperine. Now, if a person is taking turmeric which has piperine, if the same person is taking a statin for his cholesterol, or any antihypertensive, or any other drug, any anti-diabetic drug, now we really, like, there are so many drugs that effect of piperine with all these drugs is not studied. Now imagine if those drugs also remain in blood more than they are required. Now every drug is a chemical, and when it remains in the blood in higher quantities, it is bound to give toxic effects. I mean that, like, it's a absolutely a common principle. So without a person knowing that what piperine is doing, apart from to turmeric, to other drugs that he might be taking or she might be taking, it can really the person can end up into some side effects from that drug, and the actual reason will never be probably known. So piperine indiscriminate use, definitely not recommended. So apart from this, turmeric in itself is inherently safe. We all know. You will say, "Oh, that's nothing new." But when I say that, it means that the curcuminoids, even if they are like sort of isolated and used, they are found to be very safe in the multiple animal toxicity studies, which are done as a standard procedure for all the drugs also, and for the supplements also. Ideally, we should be doing. So in such studies, toxicity studies, turmeric is found to be safe. The US Food and Drug Administration, US FDA, has declared turmeric and curcumin as generally regarded as safe. So, US FDA is generally very, very stringent about where and which ingredients it will allow to be, to be used safely in their food supplements. They have also recommended that turmeric and curcumin can be used safely in the food supplements. So, to summarize, what makes a good curcumin or turmeric supplement? It should be standardized for percentage of actives. The percentage actives should be very clearly available for information to the consumer or the patient. It should be formulated with care with natural ingredients using synthetic excipients and organic solvents, which are used in controlled quantities in medicine. Cannot be used indiscriminately just to extract or make a herbal ingredient bioavailable. That's not formulating it with care. So ideal herbal supplement, a curcumin supplement, should be formulated with keeping all these points in view. It should be easily absorbed, and it should be highly bioavailable, because that is the main issue which is faced by turmeric and curcuminoids. most importantly, it should be clinically validated, and the studies should be also accepted in the scientific fraternity through peer-reviewed publications. So, suppose if like studies are done, but if they are not done as per this global standard guidelines, then when you go out in the world, then the scientific fraternity is very sternly ready to reject such studies. So, it's not only important that the studies conducted on the patients, on the subjects, on the humans, but also it is accepted by the scientific fraternity the world around. And of course, supplement should give what is required for the end patient. What I require today, I cannot take three capsules of turmeric supplement. I cannot take 3 teaspoons of turmeric powder. So, how the compliance is improved? That is the prime issue which should be tackled. So, it should be designed for higher compliance. So, these are some of the factors which are required uh, before manufacturing or designing a turmeric or curcumin supplement. Okay, so I think let's do some interesting exercise. So Rajat, let's just ask our
Yeah, so
audience.
this is
Yeah.
my favorite part of the session that we've designed. So I would love to kind of ask you all a question, right? So we have taken few labels of some popular supplements that are available. So the first question is this product standardized? So by reading the label, can you determine if the product is standardized? So Mithilesh says yes. I don't know if there are any more people with votes over here, but Shafali, what's the correct answer?
Well, the word standardize is definitely mentioned here, but if you look at the label more carefully, like it is curcumin, standardized to 95% curcuminoids. The quantity is written very clearly, 500 mg. But if you can look at the first line, it says curcuma longa root extract, which is only 5%, and that is used in the quantity of 800 milligram. So now it is up to you to calculate how much curcumin, this dimethoxycurcumin and dimethoxycurcumin is coming out from that extract. So you do your own math to add to it.
Yeah.
Again,
And
bioperine
is
is
this
used here. Yeah.
yeah, yeah. So question is the product bioavailable then? So Rohit, you also answered yes earlier. So but now the next question is this product bioavailable? This
Yeah.
is
So
like a
do we have
pop
any
quiz,
answers?
guys. Not yet.
Okay, so yeah, that's what
No
I think
answers
I'd
yet.
already gone
Yeah.
through that answer. So yeah, as goes for turmeric supplements, bioperine is used to make the curcuminoids bioavailable. But yes, we already have talked about the potential, side effects which can happen with bioperine.
Yeah. But yeah, so a lot of people, some people have said can't say from the label. Vishal said no. Mithilesh said yes. So I would say that the product is inherently not bioavailable, but the issue, what is used is piperin is used to tackle that issue, which may not necessarily, like we said, be safe for long-term use. But the good news is at least there is a branded ingredient which is used here. So you can always go and read up more about it. We can go to the next one.
Yes.
Okay, the next label here, again, I'll give you all a second to go through it. It talks about something, it's ensuring 100% bioavailability using nanotechnology, and it claims 90 times higher efficacy, even with a much lower dose. And if you look at the formulation, it says nano formulated 200 milligrams, and it again has a 5 milligram of piperin. So I guess one of the questions I would like to ask you, Shafali, is that if the product already is bioavailable, then why is piperin, what could be the reason piperin is used here?
Yeah, so that is a question I think even I would like to ask, that if it is already nano formulation, then there is actually no need of piperine, if at all. I
Yeah,
mean, first of all, piperine is not the ingredient which should be used for increasing bioavailability, but it is nano
yeah,
formulated. And I would like to draw one, attention of our, viewers today, that nano formulations are really they should be studied for their toxicity and for their efficacy as well, because nano formulations have the capability to cross the blood brain barrier, and then its effect has to be studied. So
Yeah,
that is
but
one
and
thing.
one thing I do, yeah, and one thing I see missing here is that it's definitely not using any kind of a branded turmeric ingredient. So high chances that it's not being clinically studied for efficacy at the doses that are being mentioned here. All right. So,
Yeah.
but we can't tell for sure until we dive significantly deeper and study this more. You want to go to the next label?
Yes.
Right? Sorry, this is maybe a little bit small to read. But again, here we are talking about each capsule contains term extra 60M, which looks like a branded ingredient. And it talks about 150 milligrams of curcuminoids. And then it talks about the actual ingredients listed are curcuminoids 95%, rice bran, maltodextrin. So question for, I guess, the crowd, you all can answer as A, B, and C is this product standardized? B, is the product bioavailable? And C, are there clear answers to what has been used to tackle the issues in turmeric? You can wait for a second till people answer, and then Shafali, you
Yes.
can provide the answers. This is like like I said, this is like the pop quiz after having studied turmeric a little bit now today. Can you all read through some of this? And I feel like every supplement manufacturer is guilty of, making sometimes these labels confusing. Sometimes it's not necessarily by design. Sometimes it's just, until you are sitting in the seat of a consumer, it becomes too difficult. So Neha said yes, no too ambiguous info on the label is her answer. So Shafali, can you answer for us?
Yes, so I think the label contains what the information required for the consumers. It is very clear in terms of the actives which are present in the product. Of course, the dosage and the benefits are also well listed, and the branded ingredient is highlighted quite well. So the consumer can go on the web and search if there are any studies, if it is backed by science or not. So this kind of information is really helpful for the consumer. And I think we have taken this small exercise of reading the labels to make our consumer, used to looking more closely at the labels before
Yeah,
they make their decision.
yeah.
Yeah.
I think we have a
So,
last label.
yeah.
Yeah. So this is another product. We apologize for the blurred text, but that's the best quality we
Yeah.
could get. This says each liquid filled vegetarian capsule contains curcumin powder. Again, a branded ingredient. Says curcumin extract 20% in 250 milligrams. So 20% of 250 will be 50 milligrams, and medium chain triglycerides, which are 250. And then you can see the nutritional info below.
Yeah, so I'm sure while they are, reviewing the label, but I'm confused whether it is curcumin extract or curcuminoids, or the words,
Yeah.
not giving clarity to
Yeah.
me.
Yeah,
So
I feel while they've used a branded ingredient, the all the ingredients are not listed very clearly. So what is going inside curcumin, unlike the previous label, is not very clear, and that could be an issue. All right, and our goal here, guys, is to really keep it as neutral as possible. That's why we have not mentioned any of the brands, but to specifically point out issues that are on labels and why they could be difficult to read, and where you can look at, when you look at the energy, protein, carbohydrates, sugar, I think that's another place where you can pick a cue to say, okay, carbohydrates is also 0.16, sugar is also 0.5, and technically, there is a requirement to say sugar and total sugar and added sugar, which a lot of label manufacturers are still not in compliance with, so which is an issue. All right, we can move forward, Shafali. So I hope this
yeah,
exercise was fun, and I think if we move on,
yeah. Some
oh,
one
we do
more
have
label.
we have one more label, okay, and this is kind of interesting. It's one of my favorite ones here, because this talks about one capsule twice daily before meals. and it talks about a proprietary herbal blend in which turmeric extract is 95%, but only, which says 118.75 milligrams, there's 125 milligrams of it. So this we know, is it standardized? I don't even think, I mean, it is an extract, but it is not looking like a, well, it is a standardized extract, but it is definitely not in the required dose, right? And I
Yeah,
don't believe
so,
there is anything added here to improve bioavailability.
yeah. So where the
Yeah, did
standard
I?
turmeric extract minimum dose is like 2000 milligram, 125 milligram is given here in this label. So these are few examples.
Yeah. All
Okay,
right,
so now
perfect.
I
Now
think,
we just, yeah, so we will now just move on to the submitted questions. So when you're registered, you'll all submitted questions to us, and we will try our best. I know we are over 45 minutes into the conversation, so we're going to try our best to speed through this process.
yeah, so I'll just quickly, we can look at these.
Yeah. So the
So the
first
first,
question is, Shafali, yeah, you want me to read the questions out to you? So is turmeric
sure,
milk really that effective?
Turmeric being, enriched with so many health benefits, it is, and in the milk. But what happens is because of we take turmeric in hot milk, so it is because of that warmth of the product itself. It gives a tentative and localized effect, especially in cough cold. So definitely in cough cold, it has that effect. But for taking it
All
for
right.
other health benefits and every health benefits, no, I have my own doubt.
Does turmeric, excessive turmeric, cause heat in the body? And I think this is very relevant because with your practice in Ayurveda, also you can answer that question even from that angle.
Yeah, so I think this question comes from typically like we are used to, and it is mentioned in Ayurveda, every substance, every herb is divided into two potencies, cool or hot, or that is like called as Shita or Ushna. So I think that's how we all are used to saying that, like that this will be very heaty or this will be very cool for the body, like that. But in we all eat so much of turmeric every day on day-to-day basis. So I don't think that turmeric is it can cause heat in the body in that sense. So no, it doesn't. So the I think the question further says that if bioavailable low dose supplement overcome the heat effect. So basically, that kind of heat effect is not seen when turmeric is taken in the supplements in the recommended doses.
Fair enough. Thank you. Next question.
Yeah.
That is what turmeric is, and these are questions are taken verbatim, guys. So we haven't edited it, so there might be some grammatical issues. But what turmeric is said to be anti-cancer? What does it mean
Yeah.
and how it acts?
So I think we have taken it in very brief because cancer is such a subject that you cannot like just even briefly if you want to talk it will take a long time. So it does have a chemopreventive action, and it acts through multiple pathways. That's all we can say, and a lot of research is ongoing currently to give
All
us
right,
more
thank you,
information.
Shafali. Is curcumin percentage the only indicator of good turmeric? I think a lot of y'all can answer this question based on what we discussed, but maybe we can reiterate what beyond curcumin percentage is a good indicator of good turmeric, Shafali.
Yeah, so now we have seen that even if it is, for example, 95% of curcuminoids, its bioavailability is one of the important things that matter. So whether it is bioavailable or not, whether it is, whatever dose the manufacturer is proposing, whether it has been tried and tested in the patients and in the human subjects or not. These are a few of the important questions that should be answered before we can say whether it's a good or bad turmeric supplement, and also the amount of
Fantastic.
and the quantity of excipients which is used in each supplement.
Right. Is turmeric antibiotic or anti-inflammatory?
I think we have answered this. Turmeric is a very a good anti-inflammatory, and yes, the antimicrobial or the antibacterial effect of turmeric has been tried in a lot of in vitro studies. But amongst the two, I mean, between the two, I will say it's a potent anti-inflammatory.
All right. Would like to know more about forms in which turmeric should be consumed for the best results. And I think I can take this question up because I am a big proponent that if you're going to take a supplement, just consume it as a capsule. All the capsules that people use today, you can read and find out if they are vegetarian capsules or not. But when you take it as a capsule, you're only getting the active. The moment you take a gummy, you take oral dissolved film, and we develop a lot of these kind of formats also where required. But because there is a big taste angle that comes in, a lot of other items go in, ingredients go in. Not everything, there's sugar that goes in, and how much ever somebody tells you that there is no sugar, there is always a little sugar lurking around. And all of that just becomes extra for you to consume, versus you could have taken a clean, certified clean label capsule with the ingredient inside and had zero additional calories, zero additional anything that you would have consumed. So I would always recommend to take turmeric as a powder, which comes from a good source, or as a supplement in a capsule.
Yeah, I would really agree with you here, Rajat.
Any
Yeah.
benefits for hair and skin?
Well,
All young girls want to know this. And some balding men.
I would love to give this information because skin health and turmeric go, I mean, they are almost like synonyms. So we all know that there is a program of haldi before every wedding, every marriage, wedding ceremony, right? So that is because of the skin health promoting effects of turmeric. In Sanskrit, turmeric is also known as Yoshit Priya, meaning it is the loved ingredient by the young girls. So I don't need to, further highlight the skin health benefits. And of course, there is a lot of clinical literature available to reconfirm this mention in Ayurveda. Of course, turmeric has, because of its good health on skin and skin diseases, it has its beneficial effect on hair care as well. So, yes, because of its anti-inflammatory, antioxidant effect, it can be definitely used for skin and health, hair
So
care.
when the hair loss is due to some anti-inflammatory action, that's where it would exert an effect, more potent
Yes,
effect.
absolutely.
Fantastic. And how much dose is sufficient for immunity?
Okay, so I would like to ask the question. So, how much dose of turmeric is sufficient? So, like, well, if you're taking a powder, it will be like 8 grams. If you want to take an extract, it will be like 2,000 milligram. If you're taking some good, all natural bioavailable turmeric, well, a small dose of one capsule also will suffice.
Yeah. But I
So,
think
it
it's
depends on the
important
person.
to always see if there is a branded bioavailable turmeric, what is the dose that they are recommending and what are the doses at which their studies are done, because both
Abs-
of those should align and that should tell you the dose required.
Yes, thanks for highlighting the need of robustly designed clinical studies once again, Rajat.
And is there any adverse effect of turmeric on our body if the dosage is higher than RDA? And I have a similar question also by Rohit from the audience, which is high consumption of turmeric, is it harmful and what is the limit per day?
See, turmeric is a food ingredient at the end of the day. We are eating it in large quantities anyways, so it's not harmful in that sense. But in Ayurveda or in Sanskrit, what we say, ati sarvatra varjayet. I mean, you can't take like 10 grams or 20 grams of turmeric powder every day, and then it is bound to have some effect on it, GI tract especially. If you do like almost like a toxic dose of, otherwise safe turmeric. But otherwise, in clinical trials also, we don't observe major adverse effects by turmeric, apart from some minor GI upset.
Yeah, so basically there is no RDA defined for turmeric because it's a food ingredient. And again, going by the doses which are defined by the brands, and like Shefali said, there is, based on the toxicity studies, 8 grams of turmeric powder, 2,000 milligrams of your standardized 95%, and or a lower dose, like, a 250 milligrams to a 500, depending on which brand of turmeric you're going for, will establish that it's efficacious at that dose and then therefore also safe, because for every study, and correct me if I'm wrong, Shafali, but every study, safety is always an endpoint. So we always look at the safety angle for any study that gets performed, which gives you that additional amount of data.
Absolutely, and thanks for highlighting this again, Rajat, because the doses which are recommended by the supplement manufacturer should be generally, considered.
Again, so this is interesting because this comes about contraindications. So can you just shed some light on this?
Yes. So if because the turmeric supplements today they are part of like dietary supplements. So if anybody is on lifestyle disease related medications which are generally lifelong like blood thinners, anti-diabetics, antihypertensives as they are mentioned here, then the physician should be knowing that you are taking a turmeric supplement. The reason behind this is for diabetes, for hypertension, turmeric can have a beneficial effect, and probably it has the potential to reduce your dose of the modern medicine. So that is the reason that the physician should be kept well aware of you taking turmeric supplements. Precautions for uses, once your physician knows, then they will know. For example, if it is with blood thinners, then the way they stop it before the surgery, then they can stop, they will stop your supplements as well. So these are the only precautions required. Keep your healthcare advisor well informed.
All right, thank you, Shafali. In what percentage should curcuma longa be present in a capsule? I think these are like we're getting similar questions from different angles, right?
Yes.
And I believe these are maybe one of our last ones. Any comments here, Shafali?
Yeah, percentage, it depends on whether it is bioavailable or whether it is just a standardized extract. And also, percentage is one thing, but then the dose is another thing. So, how many such capsules should be taken? So, it goes hand in hand. So, just having a particular percentage of curcuma longa is not going to really say anything about the product.
Mm. Like one of our products has 60%, but that 60% is bioavailable, derived from a standardized 95% extract, and we guarantee the 60% with every dose. I think that's where the difference comes in. But there could be another product which has 20%, but it has nothing done to formulate it to make it bioavailable. Or it could have, it could be bioavailable, but there's still a lower quantity and therefore a higher dose. So I think these things are so important. And again, the studies are what I feel sell it for me, because it's very important to know what was the dose at which the studies were performed. Are the studies peer reviewed and published? Was the study design, robust? And has it been accepted by the larger medical fraternity as well? So I think these are things that no brand can hide behind and becomes important to highlight.
Absolutely. Yeah, sorry. So, I think this is one question.
And the question is turmeric
Yeah.
extract beneficial for back pain? If yes, then how and timeline?
Well, turmeric's importance in musculoskeletal health is very well established. So definitely yes. And timeline, generally you see results depending again on the type of product that you are using. Within 2 to 3 months, the results are evident with a good bioavailable turmeric supplement.
Yeah, so generally, and I've seen that in most of the studies, 3 month is a quite a standard timeline. And if the study shows a 95%, at a 95% confidence interval, statistically significant results, that means that you're highly likely that within 3 months you will see a result. But sometimes that, you could be one of those 5% of the population as well who might take longer or who might even see effect, much sooner. You never know. Yeah, but three
Yes,
months is on an average. We say that if you've started a therapy, you may want to continue for 3 months. It's like losing weight. It's like doing anything else. There are no overnight results.
absolutely.
Yeah. And taking turmeric can solve cough issues. Shafali's already answered this previously because a small dose with
Yeah.
milk, warm milk, can definitely be very therapeutic for a localized action in your throat. And a turmeric supplement will also work the same way, where it will suppress the inflammation and help with improving your cough symptoms.
Yes, with good bioavailable turmeric products, the experience in even cough cold has been very good.
Yeah. How is bioavailable turmeric better than fermented turmeric products?
Well, this is again a question where, formulation related question, but I can say that even if the turmeric product is fermented, it doesn't reduce your dose, it doesn't increase its bioavailability. So, uh, those benefits will not be available. Whereas if the turmeric product is made bioavailable with good processes, then it will really lead to better benefits with lower dosage.
Thank you, Shefali. And I think this one's right up your alley to say what is the right dosages and side effect of turmeric and sulfur.
Well, I think this question has come from some background in Ayurveda, because in Ayurveda, sulfur is used in combination with mercury as a I can say herbometallic preparation. But in that case, the advice of proper Ayurvedic physician is really required, because sulfur mercury combination is used only in Ayurveda. Like it's not used in supplements. These being metals, so they are purified and then utilized to exert a drug-like effect. So in such
And these
cases,
would be, yeah, and these would have to be customized to the individual also, the dosages then.
absolutely, absolutely.
Right. And are there, I think this is the second last question, are there any known benefits of turmeric in the prevention of Alzheimer's disease?
Yes, a lot of research has been done, is being done in use of turmeric and curcumin in Alzheimer's, because the free curcumin, which gets to the brain tissue, has a capacity to reduce the beta amyloid and the tau protein reduction in the deposition reduction in the brain tissue. So yes, it is
Yeah, and
researched.
yeah, and the only thing I can add here that I know that one of the leading causes of a number of neurological diseases is this tau protein accumulation. And I think, Shefali, we will definitely need to conduct another session to talk about free curcumin because I think we've missed
Absolutely,
talking about it throughout the presentation otherwise.
yeah,
All right, but to
yes,
summarize and to reiterate what Shefali said was that free curcumin is a metabolite, which basically is the only type of curcumin that can cross your blood-brain barrier and therefore
yeah,
exert a therapeutic effect on your brain.
yes.
So again, when you look at the clinical literature, it's important to see if there was a percentage of free curcumin in the studies through different types of studies, and this is generally only something that can come out of animal studies
Yeah, so
to
I
see what
think
is the percentage of free curcumin. Yeah.
we can talk about it more when we talk in detail about the pharmacokinetics of
Yeah.
curcumin, which is a topic of great interest.
And I believe our last question is, can turmeric be formulated with probiotics?
Yes, definitely. But again, this is a formulation related question. So any such queries you can write to us, and then we'll take it further. But definitely, turmeric can be formulated with probiotics.
All right, fantastic. If anybody has any questions, y'all can still post them in the comments, or Shafali and me will hang around for a few more minutes to see. And if y'all have any comments, any suggestions for a future session, please feel free to leave a comment about it. We will send you a short questionnaire later to just get some more pointed feedback from you. But Shafali, if you can just go to the last slide here, which talks
Yes.
about a Partners in Health program. So one of the big reasons for us to even conduct classes like this is to encourage use of our Partner in Health program, which is really just about encouraging the and spreading the word about the right dose in the right format. So you can join our program. There is a link that will show up on the screen right now. You can use that link. It's partners.natureandthought.com, or you can scan the QR code on the screen. So any one of those methods you can use to join. And once you join, we are actually using this masterclass to also launch our WhatsApp community. So you can join a WhatsApp community to just learn, and our goal will be to just share pertinent information, new studies across different therapies with you. So if you become a partner in health, then you can have access to that WhatsApp community as well. All right, fantastic. Thank you so much, Shafali. This has been I think I can always still learn a little bit more. And thank you to our wonderful audience who joined the conversation today. If you all have a burning question that comes up later, you can follow us in any of the channels and you can or email us at wecare@natureandthought.com, or just send us an email on the email that you've received the information for this session. So any one of those approaches work, and we look forward to continuing this conversation in the future.
Absolutely. It was great to talk to our audience today. And thanks, Rajat, for it was a very interactive session, and even I enjoyed it. I hope our audience enjoyed it too. Thanks, everyone.
Awesome. Thank you so much. Take care, everyone. Bye bye.